Welcome to Conversations with Melissa, part of RenaFi's Experts and Influencer series. RenaFi provides practical, research-based advice, courses, and peer support, and focuses on the underlying drivers of our ADHD behavior. Through courses like budgeting for the ADHDer, home organizing for the ADHD lifestyle, and of course, our ADHD book club, to name just a few, we provide a holistic program that serves to help you thrive with ADHD, not in spite of it. Follow our YouTube channel for ADHD resources and information, and visit us at renafi.com to learn what we have to offer. Thank you so much to our guests here, Dr. Bill Dodson and Beth Bardeen. So today we're going to do RSD from two perspectives. We have Dr. William Dodson, the clinician, what RSD looks like from the outside in. Dr. Dodson is a board-certified adult psychiatrist who does not have ADHD. He has worked with his adult ADHD patients for the last 25 years to understand and document rejection sensitivity dysphoria. Dr. Dodson has been on the forefront of diagnostic and treatment reform for ADHD and rejection sensitivity dysphoria. He is now retired from clinical practice and resides in Colorado. Beth Bardeen, the RSD survivor, what RSD feels like from the inside out. Beth is an adult diagnosed with ADHD after a 30-year career in the Seattle tech industry, specializing in marketing and organizational behavior. Now Beth researches rejection sensitivity dysphoria and is an advocate for the newly diagnosed, with a focus on explaining the internal experience of RSD. She lives in Seattle and is the founder of the Seattle chapter of CHADD. All right, thank you both for being here. And
Melissa, thank you.
I'm just going to step out of the way. I'm going to take the focus off me and let you have at it and interrupt you every so often.
Sure. And thank you, Rick and RenaFi too. This is, we love this opportunity, really appreciate it. So I'm going to change the title of this slide to, you're working with a great ADHD doctor when. These are questions that I have, I guess, gleaned from listening to Dr. Dodson's webinars of how to know whether or not any doctor will entertain this. So what is your experience of ADHD across the lifespan? That would zero out somebody who doesn't believe in ADHD in adults. That's changing quickly, but it's still out there. How do you trial ADHD and RSD medications to get the best outcome? This is, may not be slide number 29 anymore. I'll have to double check that. This is what I was asking earlier about what should you expect your ADHD clinician to do during your trial process, so that if you're having difficulties and you need a change, you don't have to wait until you can get an appointment. Do any of your patients work with psychotherapists or coaches? They should know some, and they should be open to those things. And how do we work together over time? I've asked sometimes when I've interviewed clinicians to speak for Seattle CHADD, and I've asked these questions. Sometimes they don't respond back. They don't have answers to these questions. And so they're not, they don't have a good basis of understanding for ADHD, and they're not open and curious. So figuring out what works for you, the medications. And I was medication resistant in the beginning because mental health meds are evil and scary until you learn about them. They can help you. The best way I can put it is rise up. so that you can start building what you need to really flourish. So starting with the medication and health professionals, a lot of times you have to ask to try the non-stimulants, guanfacine and clonidine. And a lot of times, especially if you, well, not, I haven't actually encountered anybody with an age cutoff. The GPs don't want to do it because they don't want to give you a heart med. They're not familiar with it being an ADHD approved medication. Communities and social relationships are the next important thing from my experience, just so that you can have that connection to feel normal and validated and seen. I mean, all these mental health words that when you feel them, you can tell. And then comes the really hard stuff, which is the therapy and the other self-work, because there's not really any scaffolding other than what you put into your own life. And so I don't know about you guys, but having ADHD makes it really hard for me to take on any new habit. And so I have to keep trying. And one of my sons calls me the little ant that thinks she can move the rubber tree plant, because I will completely miss it. I'll run and start again. You have to keep trying over and over again on your sleep, on just doing the things that are going to give you your reserves. And I used to think that mindfulness was a bunch of empty nothingness. But once I learned that it's just focusing your breath as a starting point, there's so much more that you can take from there. Doing this type of stuff, journaling, even if you don't do it every day, it helps you build the skills. You don't necessarily see it in the moment. It's like going to the gym. You might work out, doesn't feel great. You might not do it every day, but you will see the cumulative effect. Let's see, there we go. And then this is my checklist. Seek out a specialist. If I get one message across to people, don't just go to your GP to ask for ADHD meds, because they don't know how to get you to the right medication or the right dosage. And like Dr. Dodson was saying, with the stimulants, there's like 2 different kinds, but 40 different varieties. And so getting the right ones with the right dose takes somebody to really work with you. And when you work with your other providers, let them know about this. And in the best case is that they will be interested and curious, and it'll influence their work with you. Or worst case, but also good information, if they gaslight you, dismiss you, that's good information to have. There's nothing worse than having your RSD rejected. When you are in a family structure, as most people are, you want to find family and couples therapists with ADHD, because otherwise you will spend a lot of time defending why you do what you do, because they don't understand it. And they will also try to pigeonhole you into a mood disorder. And working with an ADHD coach is like working with a fitness coach. It isn't about, they work with you to understand what your goals are and to help you get to the point to where you are understanding what your needs and wants and wishes are, what you think your 2.0 person is, so that they help you harvest what you want, what you want your plan to be to help you get there. It's a great opportunity to do it. The support groups, cannot say enough about that one. Learning to track your RSD episodes and your triggers, duration, and context, that will help with the people that are around you that are on the other side of these episodes, and it'll help you know if there's a pattern so that you can start, if nothing else, know that it's going to end, and that it's not a panic attack. Identify your triggers. Yeah. Just knowing so that you can see them coming. You can, as Dr. Dodson says, prevention is key. Even if you have your armor on, or if your armor's not doing its job, or you haven't been taking it consistently, you can have these other mechanisms to help you get through those episodes. And then, some of us, specifically me, I'm impatient. I will throw all the spaghetti on the wall to see what sticks. I'm too impatient to try one, see how it works, try the next one, see how it works. But trying to figure out what works and what doesn't work is really important, so that the more you can fine tune it, the better. And one of the great things with hanging out with the support groups is talking with other people about things that you can say to the well-meaning friends who say, well, nobody likes rejection, or everybody's a little ADHD, or everybody's disorganized. It's, getting to a point to where you're not defensive and you can help them understand you a little bit better, takes a big load off of you. So right where we started, the take-home messages. I think Dr. Dodson and I have kind of covered these into submission, but RSD is real. Learn about it, notice it, and find support.